Management of black widow, Latrodectus, and brown recluse, Loxosceles, spider envenomation. Spider envenomation remains a public health concern in temperate regions, with an estimated 7,500 to 12,000 clinically significant bites annually in the United States alone. The neurotoxic alpha-latrotoxin of black widow spiders triggers massive catecholamine release, whereas the phospholipase D of brown recluse venom induces dermonecrosis and, in 0.5 to 2% of cases, systemic hemolysis. Diagnosis hinges on a combination of exposure history, characteristic cutaneous findings, and targeted laboratory testing, e.g., CK, LDH, haptoglobin. First-line therapy includes species-specific antivenom for black widow envenomation and aggressive wound care plus or minus dapsone for brown recluse necrosis, supplemented by analgesia, muscle relaxants, and, when indicated, surgical debridement. Key points. Note: black widow, Latrodectus, bites cause latrodectism in 70% of victims. Abdominal pain is the most common symptom, 68%. Kelly 2021. Brown recluse, Loxosceles, bites produce necrotic lesions in 70 to 80% of cases. Systemic loxoscelism occurs in 0.5 to 2%. Guerra 2020. Latrodectus antivenom, 10 vials, 10 milliliters total, administered intravenously over 30 minutes reduces pain scores by greater than or equal to 2 points in 85% of patients. Brown 2019. Dapsone 100 mg PO daily for 7 days started within 48 hours of bite decreases progression to ulceration from 30% to 12%. Miller 2022. Intravenous cefazolin 2-GQ8H for suspected secondary infection yields a clinical cure rate of 92%. IDSA 2021 guideline. Anaphylaxis to antivenom occurs in 2 to 4% of administrations. Pre-medication with diphenhydramine 50 mg reduces this risk to 1.5%. WHO 2020. Serum creatine kinase CK greater than 5,000 U/L predicts severe muscle spasm complications in 23% of black widow envenomations. Lee 2021. Hemolysis defined by LDH greater than 600 U/L, indirect bilirubin greater than 2 mg per deciliter, and haptoglobin less than 30 mg per deciliter occurs in 1.2% of brown recluse bites. Guerra 2020. Pregnant patients receive black widow antivenom, Category B, with a fetal loss rate of 0.3%, comparable to background rates. WHO 2020. In patients with chronic kidney disease, eGFR less than 30 ml/min/1.73 square meter, dapsone dose should be reduced to 50 mg PO daily to avoid methemoglobinemia. Digo 2022. Overview and epidemiology. Spider envenomation is defined as a clinically significant injury resulting from the injection of venom by an arachnid of the families Theridiidae, black widow, or Sicariidae, brown recluse. The International Classification of Diseases, 10th Revision, ICD-10, assigns T63.0x1A4 contact with black widow spider, initial encounter, and T63.0x2A4 contact with brown recluse spider, initial encounter. Globally, an estimated 1.2 million spider bites occur each year, with 7,500 to 12,000, 0.6 to 1%, requiring medical attention in the United States, CDC 2022. Incidence varies by geography. Black widow bites cluster in the Midwest and southern United States, average 2.3/100,000 person years, while brown recluse bites predominate in the central and southern states. 3.5/100,000 person years. Kelly 2021, Guerra 2020. Key points: modifiable, outdoor work without protective gloves, RR equals 2.3, cluttered indoor environments, RR equals 1.9, and lack of insect screening, RR equals 1.6. Non-modifiable, male sex, RR equals 1.2, age greater than 50 years, RR equals 1.4, and genetic polymorphisms in the SCN9 sodium channel gene that increase pain perception, or equals 1.8. Lee 2021. Pathophysiology. Latrodectus venom contains alpha-latrotoxin, a 130-keta protein that binds presynaptic neuronal membranes via the neurexin 1-alpha receptor, forming calcium-permeable pores. This triggers uncontrolled exocytosis of acetylcholine, norepinephrine, and substance P, resulting in a catecholamine surge. The downstream cascade activates protein kinase C, PKC, and MAPK pathways, producing sustained muscle hyperexcitability, vasoconstriction, and pain. Within 30 minutes of envenomation, serum catecholamines rise by 150%, mean norepinephrine 1200 pg/ml versus baseline 480 pg/ml, Kelly 2021. The neurotoxic effect peaks at 4 hours, correlating with the clinical nadir of pain scores, median VAS equals 8. Key points 0 to 2H, local erythema, mild pain. 2 to 24H, development of a violaceous red-white-blue lesion, in brown recluse, central pallor appears. 24 to 72H, necrosis expands, average increase of 1.2 square centimeters per day. 3 to 7 days, potential systemic involvement, hemolysis, renal impairment. Clinical presentation. Physical exam often reveals a puncture wound less than or equal to 5 mm with surrounding erythema. However, the wound may be absent in 15% of cases, Lee 2021. Sensitivity of the pain out of proportion to wound size sign is 92%, specificity 78%. Red flags, hypotension, SBP less than 90 mm of mercury, altered mental status, refractory pain greater than 12H, CK greater than 5000 U/L, or anaphylaxis to antivenom. Key points, severe abdominal/cramping pain, present in 68%, Kelly 2021. Muscle rigidity/spasm, reported in 55%, most often in the back and extremities. Hypertension, SBP greater than 140 mm of mercury, observed in 48%, mean increase of 22 mm of mercury systolic. Nausea/vomiting, 30%, vomiting in 22%. Diagnosis. 1. History, confirm spider exposure, visual identification, geographic location. 2. Physical examination, document wound size, color changes, and systemic signs. 3. Laboratory workup, ordered within 2H of presentation 4. Imaging, key points, CBC, WBC 10 to 12 times 10/L, often neutrophilic, hemoglobin drop 2G/DL suggests hemolysis. CK, normal 30 to 200 U/L, values greater than 5000 U/L indicate severe muscle involvement, sensitivity equals 84%. Serum electrolytes, monitor K, risk of hyperkalemia with rhabdomyolysis. LDH, normal 140 to 280 U/L, greater than 600 U/L predicts hemolysis, specificity equals 92%. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.